Hi, my name is Abby Cannon. I live in Colorado, and I'm in the 4th out of 6 terms of my Women's Health Nurse Practitioner program. I currently am outpatient OBGYN RN phone triage, and we are 18 weeks pregnant with our first. So I've looked back at my introduction video for this class. One of my goals was IUD insertion and removal. So as far as the IUD insertion, I was able to observe probably 3 or 4 of them, and this clinic actually does all of them under ultrasound guidance. So I think that's a really great tool to make sure that they're all placed correctly, and then the patients even come back a month later as well to check that it's still placed correctly. But probably towards the end of the semester, probably around the 3rd IUD, I asked if I could perform it, and that's when I learned that this clinic doesn't let students perform the IUD insertion anymore because the previous student had caused a perforation. So I did perform a handful of removals though, and most of them went pretty well, but there was one in particular that I remember, and she was 60 years old. She had the IUD inserted when she was 42, I believe. She had it in for 18 years because she says that she forgot that it was in there. And she had gone to a different provider, so this was her first appointment at this clinic. And so I went in to try to remove it, and after a few failed attempts, I could tell there was some resistance. So I finally went and got the attending. She went to the ultrasound room, and it turns out that the T was sticking out both sides of her uterus and was embedded in her C-section scar. So they ended up doing a surgical removal on her. So I thought that was interesting. And then another goal that I had mentioned in my introduction video was contraceptive counseling. Before this semester, I didn't know about the CDC medical eligibility criteria app, so I pulled that chart up a lot this semester when I was able to talk with patients about their contraceptive options. Most of the patients were in their early 20s that we did contraceptive counseling with, and I would say most of them landed on the pill or the IUD. I also learned this semester that my clinic the clinic that I did preceptorship at is very kind of against prescribing the depot shot because of the risk of bone loss and because of the excessive weight gain that it causes, which also deters the patients. So I thought that was interesting and a good thing to learn. I also wanted to see more GYN problem visits because in my fall semester, I saw a lot of annuals. So this semester, I was able to see a lot more GYN problem visits. From like BV complaints, yeast infection complaints, some STI panels. There was some breast ultrasound follow-ups for lumps, which thankfully all of them were benign appearing, and she just had them come back in another 6 months for follow-up. There was an atrophic vaginitis case, and some genitourinary syndrome of menopause cases, as well as a lot of hormone replacement therapy and lab reviews. I saw some Nabothian cysts, one in particular. A few I saw on speculum exam, but one in particular was on the transvaginal ultrasound. And they were so big and so uncomfortable that the patient sometimes felt them prolapsing. So she ended up getting those surgically removed. There was a lot of PCOS diagnoses between lab results and transvaginal ultrasound and just patients' explanations of their symptoms. And then some ovarian cyst follow-ups on ultrasound, some endometriosis as well. And then let's see, what else did I do this semester? The clinic that I was at did a lot of Mounjaro injections for patients for weight loss. A lot of them were pre-diabetic, but I don't know that all of them were. But the Mounjaro, I guess they got on some kind of program with this clinic, and the weight was coming off, so they just kind of went with it. I saw some anxiety and depression visits. They always would do a GAD score and a PHQ-9 score to follow up on the patients every visit and how the meds were working and how they needed to potentially adjust the meds. There was a lot of transvaginal ultrasounds. There was some breast ultrasounds, which I mentioned earlier, even some thyroid and abdominal ultrasounds, because this clinic didn't only see GYN, but they also saw a lot of women's primary care. So I even saw some younger patients in their 30s that had history of MI or CBA. One in particular, I remember a cardiologist had approved a combo OCP after an MI. So when she came to us as a new patient, the provider made sure to take her off of that and ended up putting her on a progesterone-only pill. So it's good of us to be astute. Even if another provider approves something, if we are questioning it, we need to consult with that provider if we believe that the plan of care needs to be changed. So thank you. Hope you had a good semester.